Happy Wednesday. Welcome to Back Talks with Dr. Sean McWilliams. It's so great to have you here, as always. If this is your first time, welcome. And if it's your 100th time, welcome back. We're going to be talking about something for people who are dealing with chronic neck pain and back pain. If you're a mom and that's you, there's a question that we want to answer. Is spinal decompression the right option for you? And with some things that you should know about it. So let's get into it and talk about it. So, is spinal decompression the right choice for you for your neck and back pain, especially if it's chronic pain? Well, it's a great question. And I think perhaps if you're asking yourself some of these questions, the answer is probably going to be yes. Why does my back keep hurting me? Am I going to have to get surgery at some point? Am I ever going to feel good again? Will I always have neck and back pain? Will I be paralyzed someday? Am I going to have to live in a wheelchair? If that's some questions that you are thinking about, I want to help put that to rest for you today. And so I'm glad you are here, and I'm excited to help you. And I want you to know that. And I want you to leave today having a new sense of hope and confidence about where to go from here managing your back pain. Okay? So let's talk about it. And I just want you to know, I was one of these people as well. I injured my back severely bad a few years ago, and let me tell you, it was not a fun experience. It was a very scary experience for me. So I've walked in similar shoes. Perhaps not feeling exactly what you're feeling, but probably feeling some of the stuff. So I'm glad you're here, and I want to help by the end of today's little live to answer questions for you. So make sure if you have questions, drop me a note. You can comment on our lives, so you'll see it. And if you send it and I don't get it, please resend it again or just refresh your browser. These don't always work perfectly, but I want to answer questions for you, and I want you to leave today feeling empowered. Okay? So, I was tired and thought that a lot of people come to me and say, I've tried everything and nothing has worked. If you're thinking of questions like that, please don't give up. Okay, please talk to me. All right, are you ever going to be active again? Are you ever going to be able to do the things you want? Are you going to be the mom that you really want to be in your life? And if that's the case, I want to help you with some stuff today, okay? So, but I want to answer some questions. Hey, if you don't know anything about me and this is your first time, I'm so glad you're here. I really am. And, in my career for almost 30 years, I've had the beautiful privilege of being on the largest covers of chiropractic magazines in the United States. I was voted one of the top spinal decompression doctors 3 years in a row as well. I've gotten to work with some really amazing people, as you can see right here. You might recognize a few of them, even though some of them aren't with us any longer, which is really sad. And I messed my back up bad, and this is my back when I injured it. I know it's kind of gross, so I'm not going to keep you on this slide at all. But it's I've walked in your shoes. So let's talk about something. I want to talk about, if you're having back pain or neck pain, why are you getting it, and what can you do about it naturally? Because if you're here, you're probably looking for a natural approach, non-surgical, non-drug approach. Well, number one thing that causes spinal pain typically is our intervertebral discs. The number two source of back pain for most people is going to be your facet joint. So let's chat about that just for 1 minute. So what you're seeing right here is you're seeing a disc. I'm not going to go into a lot of anatomy or anything today. If you want to learn more about that stuff, I've done a ton of lives. You can go learn a lot about discs and how they work, how they heal, etc. But today I just want to talk about when these outer rings, called the lamellae, which make up the annulus fibrosus, when they get torn, and this nuclear jelly that is all in here can start to escape out, like you're seeing right here where it's coming out, and it puts pressure on your nerve or a spinal cord, you're probably going to get pain most of the time. Not all the time, but in a good majority of times you're going to get pain. So let's talk about the disc today. And we don't want that happening to you. So when that happens, this is an MRI view right here. The disc will become compressed. more than likely you can see this disc that I'm pointing at right here. It'll start getting darker or black. It's called desiccation of the disc. It means that your disc is dying. We don't want it to die. There's things that we can do to reverse that process with a very high percentage of success. I want you to know that. Okay, so, but if you look at this disc right here, you can see the light gray color. You can also see the one above. So if you're looking at your MRI and you see those, you know that usually those discs are pretty healthy for you. When they start turning dark gray like this one or black like this one, that's called desiccation of the disc. It means that the discs are not healthy, they are not functioning correctly, and they are getting dehydrated on you, and I don't want that to happen to you, and I'm going to show you how to do some stuff to go about and fix that. And so what else do you need to know? We want you to look more like this picture right here. Now you can see what's interesting is this disc right here has a whiter gray color to it. Even though this one isn't bulging yet, we know that this one's in a state of disease because you can tell by the color, and the same thing right here, all right? So we don't want your discs becoming in a state of disease for you. We also want to see the spinal canal, where the spinal cord goes, nice and wide. We want this at least 17 to 19 millimeters. It's okay if it's wider than that, but if not, we want to make sure that we can keep that healthy for you. Okay, and we're going to show you how to do that. So if you're dealing with bulging discs or herniated discs, you have to try to get that material to come back in and basically, like a vacuum, suck that disc material back in like you see in these drawings right here. So if this is you and you're dealing with this, you can do two things. You can get this cut out. I don't recommend doing that because if your disc is still black like it was on your MRI or very dark gray and you cut the bad part out, the rest of the disc is still in a state of disease. So yes, you've maybe taken away a little bit of pressure on the nerve, but you're going to realize that your disc is still going to continue to become a disease state. It's going to get worse and worse as time goes on, and you're going to be dealing with this probably at a very high probability later in your life again, and you got maybe 5 or 10 more years of degeneration and disease to that disc, and I don't want that happening to you. So let's show you how to do it the right way. So what we want to do is we want to help suck this material back into the disc, okay, and get it off of your nerve. And we want to do a process like that. So now there's no pressure against that nerve or less pressure against that nerve. Then we want to try to continue to pull that disc material back in like you see here in 3, and eventually over a period of months get those outer rings to start to heal again and provide them with nutrition and water and oxygen and be able to get rid of their waste products. So it's super important. That process is called imbibition. When our discs go through a movement like this to suck material into them and get it out. So I thought I want to share this something with you because it's important, because a lot of people go, well, can't I kind of do this maybe on an inversion table? Well, unfortunately not. That actually increases the pressure on your disc and doesn't decrease it. We want to decrease the pressure on your disc. So retraction of the disc material is only half the battle. The treatment must also provide the disc with an opportunity to heal in the retracted position for long-term relief, and you can do this from home. To accomplish this, the traction force is applied intermittently. This means that for the duration of the entire treatment, the force is applied for a period of time followed by a resting phase, and we teach you how to do this. The cycle is repeated throughout the course of the treatment, and by doing this and imbibing, okay, pulling oxygen, nutrition, water into the disc, with the nutrients required for the disc to heal properly. You see this, disc to heal. Not just cut out the bad part, but actually to get the disc to heal. So how do you go about doing that? Well, you can do it with home-based spinal traction. And what does traction do? Well, when you do it correctly, and you do it where there's a resting phase and a pull phase, you're trying to create a condition called spinal decompression. And so let's take a look at it for a second here. So here is a disc. This red one that you can see is not a happy disc. There's some sort of bulging or herniation there. It's putting pressure on this nerve. This person would probably be experiencing some form of low back pain because this is the low back. And what we want to do using a tool similar to what you're seeing on the right here is traction the spine. We need to do it in a very specific way. You can't just pull on the spine. It doesn't work that way. You have to go through a repetitive motion. And which that's going to do is help pull disc nutrition and oxygen and blood supply back into your disc so your disc can start to repair itself from the inside out. And when that happens, usually you start getting pressure off that nerve and reducing your nerve pain. And we created a course that we can teach you how to do this from the comfort of your home, no matter where you live in the United States, and eventually no matter where you live in the world. So what do you need to know about degenerative disc disease? Well, check this out. By age 35, about 30% of people have disc degeneration. And this increases dramatically to over 90% by age 60. That's not good, because that means if you're in your 30s and you have disc degeneration and you don't get to do something proactive to help heal your disc like we're showing you that you can do, you're probably going to live to 85 or 90 years old, just with the amount of technology that we have today to keep our bodies going. And so if by 60 you're going to have a 90% chance of that happening, you don't want that happening where you're in your 60s, you start going into a place where maybe you're ready to retire, you want to go enjoy some other things that you saved money for, and you want to feel good doing it, right? So we don't want you by the time you're 60 dealing with all that stuff. So we can teach you a course, and I would love to share it with you at some point if you feel like it's a good fit for you, called Disc University, where we can help you if you're dealing with neck pain or low back pain, especially if it's with bulging or herniated disc. And I teach you how to manage that. We send you that piece of traction equipment. We show you with 27 video modules. And if you do the pro plan, if we think that's a good fit for you and you want some more accountability, you want me to be there for you on a weekly basis over the 12-week period, we can help you do that as well. So I don't want you breaking your spine down. And that was actually from Columbia University. So if you're dealing with these conditions, I am giving people the opportunity to book a call with me for 15 to 20 minutes at my expense, where we can talk about if you have imaging, what you've been suffering with, what you've been dealing with your back pain, what you've done, if you're taking medications, if you've had epidurals, facet injections, any of that stuff, see how it's worked for you, and see if we can help you come up with another approach that's going to be from healing from the inside out, instead of just putting a Band-Aid on it and numbing it. And then 3 years, you're right back in the same boat, except you're worse because you got 3 more years of degeneration. So we would love to talk to you. If you would love to get on a call with me, or for someone that you care about who's dealing with chronic neck pain and back pain, you can go to booking.drshawnmcwilliams.com. Right there. You'll get to my calendar for consultations, and you'll be able to fill a form out for me as well about everything you've dealt with your back, so we can have a real conversation, and I can help guide you if you're looking for a natural approach. So I hope you'll take advantage of that. I don't get to do a lot of them because I coach a lot of people around the United States as well, so they are limited. So if you'd like to do that, please go do that today, for either you or for a loved one that you know, and we'll get on, talk and say hello, and let's see if I can bring some sunshine and light into your life, and some hope back into your life about your chronic neck or back pain and how you can manage it from the comfort of your home. And if I think Disc University might be a great fit, which is the course that we've created so you can do it from home, we'd love to share that with you as well, if you'd be open to that. So thanks for being here today. It's always such a great pleasure having you here, and I look forward to seeing you guys next week on Wednesday. Have an amazing day, but go book your call so we can talk, and let's get you feeling better ASAP. All right, bye everybody.